Hi, my name is Lorena. This video is for my communications class at Goshen College. Do you have a loved one who has suffered from the results of a stroke, or can you think of a patient that you've cared for that has? Strokes are a leading cause of death and disability in the United States, so if you have not encountered this in your personal life, you probably have in your professional life. Strokes can cause neurological deficits, speech impairments, paralysis, and like I mentioned, death. Acute ischemic strokes account for 8 out of 10 strokes, and the treatment for acute ischemic strokes is TPA or alteplase, which is a clot buster. The recommended administration time for TPA is within 3 hours of the onset of symptoms. And in emergency departments, they prefer the door to needle time to be within 60 minutes. So the problem that this presents for rural emergency departments and small community hospitals is there's no neurologist on scene, so often the time it takes to consult a neurologist can knock the patient out of this therapeutic window. Levine and Gorman proposed a solution to this problem in their article called Telestroke, published in 1999. They proposed the use of telemedicine for stroke care. So essentially, the patient would present to the emergency department, and nurses and the emergency physician would assess the patient, and as soon as they saw the stroke signs and symptoms, send the patient to imaging for a head CT, and then consult the on-call neurologist. It was guaranteed that the neurologist would call back within 15 minutes on what we call the stroke bot, which is the telemedicine unit. It's essentially a computer screen through which the neurologist can lay eyes on the patient, assess them, and with the help of the emergency department nurse, they can assess bilateral strength and grip, sensation, and even listen to heart and lung sounds using a stethoscope that transmits back to them. They're even able to look at our lab results and our imaging results, which we can pull up on that screen. They then make a definitive diagnosis and give a recommended treatment plan to the emergency physician, which hopefully would include the administration of TPA if appropriate. So this can all happen within a matter of minutes, allowing for TPA to be given if appropriate. There are several hospitals that have done studies after the implementation of telemedicine for stroke, and the results have been very positive. Bon Secours Health System did a study on this, and in an article called Using Telemedicine to Get Faster, More Accurate Treatment for Stroke Patients, which was published in 2013 and written by A. Selvum. They saw a significant improvement in neurologist response times. They saw a significant drop in the time, in the door to needle time, and their rate of acute ischemic stroke patients treated early enough to receive TPA then doubled the national average. There were similar results in a string of California hospitals, which you can read about in an article called Treat Stroke Patients in 60 Minutes or Less, which was published in 2018 and written by A. Pecci. They also saw they were also able to treat stroke patients twice as fast as the national average, and their average treatment time for TPA administration was 34 minutes, and 87% of their stroke patients were treated in less than 60 minutes. There was even a hospital in Spain that implemented this, and they saw an increase in the appropriate diagnoses of their patients. Their number of unnecessary transfers fell, and the number of patients evaluated by a neurologist increased. This study was called Impact of a Telemedicine System on Acute Stroke Care in a Community Hospital, and that was published by the Journal of Telemedicine and Telecare in 2009. Their hospital was able to reduce costs significantly and improve the outcome of ischemic stroke patients due to that quick assessment time and being able to administer TPA. I also spoke with a nurse who's been practicing for 30 years, and she also praised the telemedicine system, saying that it eased the pressure on the emergency physicians due to having the expert opinion of a certified neurologist. It improved time and efficiency, saved costs by patients not having to do not having to receive long-term care or rehab, and they were able to quickly and effectively treat acute ischemic stroke patients. So I'm calling for the implementation of this in all rural emergency departments if possible, both nationally and internationally, as we can see the results work no matter what country you're in.